I always tell patients, it has to be 5 out of 10 on a pain skill level. It should not be 4, 3, or not like a nice massage. No, it should be a little bit uncomfortable just to kind of get to that scar tissue. So
Got Dr. Ahmed Nady from Peak Dynamics Physical Therapy here on the pod. Dr. Ahmed, dude, my shoulder feels amazing. This is the best that my shoulder has felt in at least 2 or 3 years. Posterior right shoulder, chronic stiffness, discomfort, soreness, tenderness from throwing. Played, I don't know if folks know this, I played D2 baseball in Philadelphia back in my last season was like '09. I played weekend baseball competitively in a couple of leagues after that in New Jersey, then in Brooklyn now. We play like one game a week, basically from like Easter to Thanksgiving. We play like 8 months out of the year, but it's like one game. So my right shoulder health is super important to me as a physical therapist and also as like a patient. We're going to get into it briefly, but I just want to say thank you for the treatment, the help with Shockwave that we did. Well, let me pull up the dates, but I just wanted to give you an update that now with spring coming around, my shoulder is feeling very different, like opened up, or it feels
awesome.
looser, or and all that with like the follow through of throwing. So I don't know if I mentioned that
Awesome.
recently, so I just want to say thank you.
No, of course, of course. Always a pleasure, Dave. Always here for a fellow PT.
So let me pull up those dates for because we did like I think it was 4 treatment sessions, but why did you go and pursue getting a shockwave device? It's usually not covered under insurance. There's some therapists that say like, oh, the research is the thing that I tagged you in on Facebook. I tagged you in
Yes,
a post.
yes. You talked to me a couple of times. Yes, I've seen that, and it is something that I thought about to kind of like stand out. We're in New York City. It's very competitive demographics that we work with. It's very busy with, every street has a physical therapy office. Every building has a couple of physical therapy offices in the same building. So I figured to kind of niche down a little bit and kind of like have something that makes us kind of stand out. Also, it happens that I work with podiatry group slash foot and ankle surgeon office, and we sublet a space from them there. And I found a huge need for non-invasive, non-surgical way to help foot pain and plantar fasciitis. And I think I've seen a lot of people not wanting injections, and or they had 1 or 2 injections and they failed. And I figured adding Shockwave could potentially prevent them from having surgery, etc. So we had a lot of success in that.
Got it. So I just pulled up my calendar. So also you and I, we've referred patients to each other, and so that's awesome.
That's awesome.
So this was September of 2023, and then into October. So I'm looking at dates now. We did 4. You treated my posterior rotator cuff, my right shoulder, my throwing shoulder 4 times between September 25th and October 9th. And each time, I think the treatment was maybe like 5-10 minutes of either like there was 2 different probe heads or whatever, but something around that, like 5 to 15 minutes or whatever. Then yes, you did some other soft tissue work. We did some, activation drills or whatever. But in terms of the shockwave treatment, I think it was probably around maybe 5-10 minutes. You switched the probe heads a little bit. We did 4 treatment visits. After the first one, I forget, did I tell you I felt like, I don't know, like physically better or like,
yeah. Yeah, typically people feel sore the next day, or and some people report that morning stiffness. They usually come along with whatever tendonitis or any active inflammation. It's usually the next day. It's always in the morning where people feel the pain. And I think you reported you woke up that day feeling a little bit looser. Yeah, so
I remember I said like, or I felt like it was almost like exquisite tenderness in a good way,
in
but
a good way.
for me, I joked and I said like baseball, right? So like you get hit by a pitch, and then like the next day might be like the most soreness that you feel. Not like an 80 or 90 mile an hour pitch that I got hit with, maybe like a 70 mile an hour pitch or something like that type of soreness. But sometimes patients, because so I'm a therapist, but I'm also a patient of yours and other therapists I've gone to over the years. some people want to feel that feedback. They want to feel that soreness. So they actually know that some treatment, something occurred. There might be
Sure.
some change that occurred as opposed to not feeling anything at all. But then some patients might get scared and call you the
Like
next
get
day.
spooked about the pain. Yeah. So I really have to.
How do you deal with that?
So it's basically all about reading the patient from day one. Like all the questions we ask, you kind of get a little bit to know about them and how they, how their pain perception and things like that. And you try to give them both scenarios. I think the key is always communication, and you tell them what to expect. And that kind of like eases the anxiety of next day if they had like a soreness, which is part of the deal. It's like first day of the gym kind of soreness, and you kind of explain it to them in a way where they're going to have understanding that this is normal. And they can always reach me or text me or email me after to kind of like give them a little bit of some suggestions or tips like that or stuff like that. And yeah, it's all about communication.
Yes, right on. And so after the first one, I was like, wow, like it felt like that really good soreness. Then the second session, I had less DOMS or delayed onset muscle or soreness or whatever. The following 24 to 48 hours, we did a third treatment session all around the same duration of visit. I think maybe different variations of like soft tissue work. We were also kind of talking about physical therapy business and stuff as well. But
Yes.
I think I was pretty much like in terms of just range of motion, like fluidity in my shoulder. Like I didn't have this, like if you're watching on YouTube back here, I used to have this like just chronic stiffness and soreness in my posterior cuff that I would usually do things like I would do self cupping. I have yeah, that like Preston, the edge mobility tool. Also, like we use the stim pod device that I think I talked to you about.
Yes.
So pulse radio frequency, which usually helps, resolve a lot of aches and pains of mine. But that device is a little more specialized for like nerve pain, like sciatica and carpal tunnel and things like that. And so I would definitely do that. And that definitely helped and took the edge off. And sometimes I would use the stim pod device. I would do it like the night before my weekend games, like last year. I would do it like the night before as like some prep, get some blood flow in there. And then maybe the night or the following day from a 9-inning game or something like that. So I was like, I kind of like, and I exercise, daily. So I'm doing drills, I'm doing, thoracic rotation, thoracic mobilizations, I'm doing posterior rotator cuff strengthening and stability stuff and a whole bunch of drills, right? So I kind of just thought like, I don't know, like at some point, even though I'm a therapist, like I'm also a patient. I'm kind of just like, all right, like this is just like my new normal. I've kind of had this for years or whatever. I'm still able to play at a high level. But after the third session with you, I was like, this feels 100%. Like I cannot believe so the dates were September 25th of 2023 was the first one, then October 2nd and October 9th. So I don't know, what's that like? So we were doing your protocol or the protocol for Shockwave is like you can only do one visit.
One visit every 7 to 10 days intervals. Yeah. So we use multiple parameters and probes to be more targeted, and sometimes we kind of like use the wider props just to kind of like get the entire area of the cuff muscles and all the rotator cuff muscles. And it's interesting that you said you tried multiple things before that, because we always try to encourage people, since it's a self-pay service, we always encourage people to try all the traditional modalities / traditional PT first, and then if everything fails, then they can use the Shockwave. And it's a great way to really get to the root cause, and not just kind of like blocking pain or it's just really getting into that scar tissue that builds up and the adhesion that builds up on any tendon or the tendons that are chronically inflamed or due to like overuse or stuff like that. And it helps break that down and stimulate that biological reaction to start the healing process. So glad that it worked.
Yeah, and so by that third visit, basically so it was like around 7 days separation between each visits, right?
Right.
So between the first and the third visit, it was like around 14 or 16 or whatever something days. I felt so good. You kind of insisted. You were like, oh, why don't we'll just do one more? So we did 4 total. But,
Yes.
if I had purchased a package of three, like I would have been totally content and happy
Yes.
with three. So I appreciate that you insisted on just like one more or whatever. And then if there was like a fourth or fifth, then I don't know, like maybe I would have like saved
I
it. Hey, can I save
yeah.
it for something else or whatever?
Well, you
So
know how to where to find me, Dave. You can always,
I know. I appreciate that.
Of course.
And also like, so yeah, and during treatment, it's a good, like, it's a good sensation, at least for me. I could see some people maybe being a little, if they're sensitive, it might be uncomfortable for some people, but I think you would then either like maybe you won't press as hard, or do you alter your treatment depending on, you said depending on the person. So maybe you don't press as hard with
Good. Yeah, the pressure is part of it, but the bigger part is the parameters. We can go down on the bars or the frequency of the shocks, and we can go low on that and adjust accordingly. And obviously, the treatment has to be a little bit uncomfortable. I always tell patients, it has to be 5 out of 10 on a pain scale level. It should not be 4, 3, or not like a nice massage. No, it should be a little bit uncomfortable just to kind of get to that scar tissue. So, yep, definitely.
So I tagged you yesterday, the day before, on that Facebook post, and someone was asking about like Shockwave on some Facebook,
Worth the investments, and yeah,
worth the investment, and someone said, well, there's not a lot of research for it, and insurance doesn't cover it or whatever. And then so the comment, there were three amazingly different comments from physical therapists. One was there's no research for it. Someone else said there's research for it, but it's paid for by the companies that sell Shockwave devices. And then Lenny Macrina came in, so he's a physical therapist I kind of know through Twitter or whatever. He's up in Boston with, I think, Champion PT and Performance or whatever. So Lenny commented, there's a lot of research for it. And he said that there's a good chunk of it that's not paid for by the companies that sell Shockwave devices. So it's amazing because it's similar to my recent social media post, which we don't even have to get into, but it's
yeah,
like
no,
there's a statement, a post, whatever. Physical therapists, we're all licensed, different states. And then it's like, there's no research. There is research, but it's paid for by the companies that sell the Shockwave devices. And then there's great research that's independent that is not paid for by the companies that sell Shockwave devices.
right.
And I read that and I was cracking up because, again, it's
Interesting to see people's perspective on things that, and you just don't, I mean, I just wonder if people who claims that there's no research, or like, I wonder if they like really did some more advanced research and just kind of like really got into it and kind of like explored if there's no research or not before claiming that. And yeah.
So Lenny then commented a really long comment, and he said something like, there's research that basically can support and refute everything in physical therapy. He says, he even gave a link to a research article, and he said, this research article says you should not do eccentric loading or strengthening for knee or patellar tendon or something like that. And then but then the next sentence was, but all the programs still teach this in physical therapy school, correct? Or something like that. So it's like that. Lenny, thank you for just independently commenting what you did, being who you are, because that's kind of, I don't know, that's kind of like, we're talking about treatment, or I don't know, when we're talking about people's emotions or opinions versus what are the facts out there. I don't know.
Interesting. I really can speak with, from my experience. I mean, even simply speaking, if we speak about like my patients who've seen me over the past 2 years, and they came with injuries that are just, there's no way out of it. I mean, they tried everything, and I've seen it, and and I've seen how effective this treatment is, and I think I do believe it works. I don't believe that it's for everyone, and people really have to be like, ask the right questions and just make sure that it's for that patient before selling it to them, because I don't think it will hurt, but it's just, again, there's an ethical point here where people coming to you desperate, and they hear about this amazing treatment, and they hear about this, and it really may not be for them because they're in acute stage, or they have others past medical history that is not compatible with the Shockwave. So yeah, I mean, it works.
So anecdotally, the way I felt after the first 3-4 treatments with you, I would 100% go and buy or finance or whatever your type of device or another Shockwave device. And they're not cheap. They're like, 15, 20, 25 grand or whatever. So it's definitely an investment. But then again, like you said, yeah, I don't know, maybe there's sometimes Tony Maritato talks about placebo and placebo effects and things like that. I don't know. I mean, maybe you could do a double-blind study somehow if there's not already about, like a modality like Shockwave or StimPod or whatever versus some controlled treatment or control group or whatever. I think maybe that's hard to know. But another thing I look at is a lot of the pro sports teams will have things like Shockwave, the Newbie device or the ARP Wave or different stim devices or other, whether it's I don't know, have you seen the other one, like the Ortho Gold, like the Softwave?
I've seen the Softwave. I've definitely seen all the ads about it, but really didn't get too much deep into it. But to me, it feels like it's a better name than Shockwave, maybe.
Softwave is significantly better.
But a better sound.
Shockwave is actually a terrible name.
It's a terrible name. Yeah, that's why the name EPAT came from, the extracorporeal pulse activation technology. This is how the people would rather say that kind of complex name, clinicians, I'm referring to, and selling it that way versus Shockwave, which sounds horrible sometimes.
Now, like athletes will, be okay with the word Shockwave, but that's why that other company uses the word Softwave, and it's like it's like ultrasound focused.
I think in my opinion, it's the same thing. I might be mistaken, but I do believe it's a better sell than Shockwave. Yeah. So maybe there's a factor there.
Now maybe I got to get that guy, Matt Taduro, Dr. Matt Taduro on my show. But so he is like the chief marketing officer or something for Softwave. And just that, you could tell that was rebranded to be, so Softwave is that's obviously for the general population. That word, that terminology, genius.
Yes.
And it, like you said, the actual treatment, the technology is actually Shockwave. That's hilarious.
It's it's very interesting. I think it's a smart way. I think it's a smart way because, a lot of what we do has to resonate with people. People have to be comfortable with this treatment, and the name can be, one of the factors that people would be spooked.
Right. Yeah. Awesome stuff. So, hey, it's Dave Kittle. Are you a healthcare business owner or physical therapy practice owner who is looking to figure out your succession plan or exit strategy? We might be able to help. And in fact, we may be interested in acquiring your practice. If you're interested, you can reach out to me. Shoot me an email at dave@conciergepainrelief.com. That's DAVE at CONCIERGE painrelief.com, or you can call me at any time, 646-781-8884.